In the clinical features, how the child will be is the heel will be small, the calcaneus is small, there are creases on the medial side and there is a stretching and glistening skin on the lateral side. When compared to the normal side, the foot might be smaller in size, and if the child has started walking, there will be callosity formation on the lateral side because the foot is inverted and is in cavus and in varus. There will be callosities on the lateral and posterior aspect of the foot. So, you have to assess whether the child is having bilateral CTEV, bilateral club foot, or it could be a unilateral. Then you have to take the history from the mother, whether a similar childs are there in the family. Then comes whether the child is associated with some of the other deformities like congenital dislocation of the hip, or it could be syndromic like arthrogryposis multiplexa congenita, where there is a differentiation of mesenchyme which has not occurred. This might be one of the commonest cause of clubfoot and it might be difficult to treat with the usual ways. Sometimes it could be associated with fibular hemimelia. I mean to say the lateral side of the fibula is not formed. So, the foot goes on the medial side and there might be a fibular or a tibial hemimelia in which the foot gets deformed. So, when the child comes to you, it is your duty to detect whether it is primary, secondary, or it could be associated with other diseases like AMC, or sometimes it could be spinal dysraphism in which the neurological supply to the foot might be hampered like paralytic foot. So, all these conditions you are assessing and coming to a diagnosis. Now, we have to do some investigation. Usually an idiopathic foot will not give you any investigation findings other than the history which the mother tells, yes, a family history of CTEV or clubfoot is there, or a family or at the time of birth the child was found at that time but we have neglected, or an initial treatment has been given but the child has no improvement. Now, investigation, in investigation X-ray of the foot is very essential because it gives you, as the child grows after the correction or after the partial correction, how much improvement is taking place, and also to compare with the other children who have been treated, how is the prognosis.